Okay, hold on.
There's always that little buffer thing, isn't there, where it says you're live, but then you're not, or you are, or yeah.
Okay.
All right.
On a second, we're coming. Okay.
Hello, everybody. We're back again. It's been a busy day. Thank you so much for all of you who've stuck through. I know that loads of you have been watching the presentations we've had streamed, and we're now in the afternoon where we've got these amazing opportunities to have live questions and answers with our speakers. I'm Benedict from Family Voice Surrey, and I'm thrilled to be joined by Gail and Grainne from who were talking about expert parent training and that transition in the health world from children's services to adult. Welcome, Gail and Grainne. Gail, would you like to introduce yourself briefly, and then we'll ask Grainne and then move on to the questions?
Yes, of course. So yes, Gail Benny. Hello, everybody. I'm a parent carer, and my son is 16. So we're just in the middle of transition at the moment, so we're going through it. He has complex health needs. Recently went through a spinal fusion. He's gastrostomy fed. He's non-verbal, in a wheelchair. So major complex health requirements. So a lot of experience in that. And as I say, going through transition myself. So yes, I am here speaking from one with experience at the moment. Grainne, over to you.
Oh, thank you, Gail. And thank you very much, Surrey, Family Voice Surrey, for inviting us to your wonderful conference. And hopefully my internet will stay fixed if I drop out. I apologise for that now. I'm Grainne Saunders, and like Gail, we deliver a lovely workshop which is not about parenting. It's about helping parents and carers understand how to use and navigate the health system to get the best for your child. And we talked very specifically about moving from children's services to adult services, because sometimes that can feel that a quagmire, and we just want to help you as parents and carers be in control, know what's going on, understand the language, be brave to ask questions, and absolutely you are a key person with your young person in making all those decisions happen and ending up in the right place, making sure you get what you need. So like Gail, I have a 16-year-old, soon to be 17-year-old. So definitely moving into the adult world. So we're living and breathing this. And my daughter has a unique chromosomal disorder, but she's the only one I know of. So that's not helpful in the world. So her needs, which is what you need to think about when you're a parent, what are the needs of my child or young person, are very much around her learning, got learning disability, has speech and language, some motor needs, movement, and mental health and anxiety needs.
Thank you so much. And actually, that's going to lead in beautifully to my first question. I really enjoyed watching your presentation. There was so much I learned. I've got 3 in transition. They're nearly 20, nearly 19, and 17. And so I'm there with you. It's a whole new world, isn't it? And,
it certainly is.
Particularly, there's something very specific I find about the transition in health, which seems to be quite staggered in ages in a way that maybe the educational social care aren't quite so much. The first question I wanted to ask you actually is, does everything that you talk about in your presentation relate to mental health as well as physical health? Because it felt very physical health led.
Absolutely. Gail, can I answer that? Is that okay?
Yeah, if you go ahead. Yeah, absolutely.
Yeah, mental health has been, and you might know, Benedict, from personal experience, massively underfunded and under-resourced, and that's really, really very frustrating, even worse in children's than in adults. So we focus mostly on physical health, and again, there will be weird things that might happen depending on what part of the county or even the local authority that you live. Some adult children's mental health services have youth services that they might be 18 to 25-year-old. You need to engage and to find out what is the local process for where you live. Some children will be on a waiting list, never receive incomes, and thinking they're going to get adult mental health services. Be proactive. Find out what's happened to your referral. Maybe you need to go back to your GP and make sure you get referral into adult mental health services.
But the GP is key to all health related, whether it's mental health or whether it's physical health. Going into transition now, your GP is your main port of call.
Brilliant. Do you know, Gail, I shall ask you this question next based on the GP. You talked about the GP quite a lot, and it seems as though as much as in the children's world, our paediatrician is our kind of port of call, it feels as though from what you were saying, the GP has to take on that role when we move into adult services.
Yeah.
So there's a couple of questions, I suppose, that I wanted to ask you. First of all, and one of these is a question that was raised with parents, from parents today. How do you, and at what age, do you need to deal with the issue of consent? At what point does the GP stop wanting to talk to me if I phone them up, and want to talk to my young person who can't talk on the phone? How does that process happen?
Yeah, good question. So you first of all need to start thinking about getting a relationship with your GP to start with, so that the GP understands your young person, understands that maybe they have no capacity, maybe they don't talk, maybe there's very lack of communication. So you start that at 14. So you make sure that you start attending the annual health checks at 14. And therefore, as you go to see the GP, they will start to understand your child and you. And at the end of the day, what you are wanting is a best interest decision. So that whatever decision is made from 16 onwards is in their best interests.
So my experience, I wonder if it's right, my experience was that when they turned 16, and literally on their 16th birthday, they would no longer talk to me. However, with one of them, I had to get my young person to sign a letter of consent. Mm-hmm. Another one, they accepted a verbal consent from my daughter. Is that, so is 16 that key age then when we need to be prepared to have that conversation, or at least have that sorted?
Yeah, absolutely. Grainne, do you want to answer that?
Thank you, Gail. The law changes. I think we said that in our presentation. In particular, there's lots of new changes when children reach the age of 16. So it's however you do that, and it sounded, Benedict, as if you got your child to voice it or to write a letter. And some people go down the very, very formal and very legal deputyship route. And there might be good reason for that. Ultimately, everything is based very much on the relationship that you have with your GP, bearing in mind that these are really, really difficult circumstances, especially if you're new in an area, new to surgery, develop that relationship, and GP surgery not meeting.
Oh, she's gone.
Oh, is she gone?
She's gone. This happened earlier, actually.
Without GP surgeries. So, yeah, absolutely. Maybe.
Yes, she's gone.
Oh, it's tantalising, isn't it?
It is. She's obviously mid-conversation. But basically, for example, my son is 16, but he has no communication. I go to the GP with him. We have his best interests at heart. So does the GP. So I can't get power of attorney because obviously he can't give me that power of attorney. I will think about going down the deputyship role, but I'll only do that if I feel that his best interests are not being looked at. At the end of the day, we want the best outcomes for our children, and so does the GP and the medical people around us. So it's not essential that you get that legal deputyship, because at the end of the day, we are working towards the best interests of our children.
Of course. I'm trying to kind of link the questions based on what we're doing, because it kind of follows on, doesn't it? We had a question from a parent who is setting up a lasting power of attorney because he's able to give consent. But apparently that can only start from the 18th birthday, and he's 16. So from his 16th birthday, he's expected to provide consent, but that power of attorney can't start until 18. Do you know what happens between 16 or 18? Or I suppose, where can parents go and find out and get some advice?
Yeah, I mean, I guess from my point of view, I haven't gone down this route. I don't need to go down this route yet, but I would suggest that they do seek legal advice on this, because again, every child, every young person that we deal with is very, very different. So I suggest that you speak to one of perhaps you've got some legal people involved with you guys over the next week as well, is ask them what their opinion is. Unless you can add into that as well, Grainne.
Sorry that my internet dropped out. So absolutely, I would be referring and looking at the Disabled Children's Legal Handbook. I'm just going to grab my copy in a minute. Anything that Steve Broach, the human rights lawyer, or Luke Clements. It's very, very tricky, and it's really important that you get proper advice. Thank you, Gail. Hold that on the screen, please.
There we
So
go.
if parents go to the Council for Disabled Children website, you can download each individual chapter. It's £50 to buy this book, by the way, but very graciously they put it all free on the Council for Disabled Children website. It's very tricky law. Please go and get proper advice, and maybe that's a good place to start. Yeah.
Thank you. That's really good. And again, that kind of touches on one of the other questions that I had for you was, where can I learn more about legal deputyship? So would that book be a good place to start, or the Council for Disabled Children?
Yeah, most definitely. But also, if you go on the government website, I was on it not too long ago, actually, looking at for myself. There's a lot of information on there. There's lots of links as well. But again, any of the legal websites. But again, this book, CDC, do start there as well. But the government website is really useful.
Brilliant, thank you. So oh, sorry, Grainne, you had something else to say.
There's a really, really lovely legal company. They're called Renaissance Legal, and their website has lots of free information.
Yeah.
And I'm not advising that you give them your money. I'm not paid for them at all. But there's lots of free stuff that they have on their website. In particular, they're leading a campaign to make sure that disabled children can have access to their funds, the child funds, which because they don't have consent, they don't have a medical capacity, it's been denied at the moment. So that's, they're nice, they're good chaps. Philip is an amazing guy, but Renaissance Legal, go and have a look at that as well.
Great. I know that loads of parents will be, it's so helpful, isn't it, to have at least that first contact to know where to start. So thank you very much. One parent asks us that their child has an EHCP with some spinal problems, actually, Gail, so I wonder whether this might thing. But this parent has been told that, or understands that the NHS don't pay for preventative measures like back braces, and was kind of wondering, were there any grants to facilitate that kind of thing?
No, absolutely. You should not be having to look for grants for your child's health. So my son, yes, we were referred up to the Royal National Orthopaedic Hospital by our paediatric consultant. If your paediatric consultant is not going to do this for you, I'd go back to the GP and ask for a referral. There are other hospitals, obviously, that also deal with this in London, Great Ormond Street, and I think the Evelyn Hospital as well. But certainly your child, I mean, Fergus was back braced for 6 years. And it was done by their orthotics department. I was up there regularly having that done. And then when his spine was at a certain percentage, he was automatically referred, obviously with our permission, to spinal fusion. And we had a massive spinal fusion operation last year, which has come through absolutely amazingly. We've probably got one more appointment and we're out the system. And it has been life-changing for him. But a parent shouldn't have to pay for any orthotics. So absolutely not. This should be, I would go back to the GP for a referral if your paediatric consultant is not doing this, without a doubt. Yeah,
and presumably the same goes for if there were problems, you have the right, don't you, to ask for a second opinion?
Well, you can ask for a second. It's not a legal right, I believe. Okay. Is that right, Grainne?
So the law, again, is tricky. Of course, you can ask, but they don't have to give it to you.
Yeah.
Right.
The NHS constitution, otherwise I think the whole NHS would fall apart if everyone demanded second opinions all the time. So it's very much based on your articulation of your need. Why do you want a second opinion? And obviously you would use all your parent guile to articulate that as well as you could. Yes, absolutely, you can ask, but you don't have to have it granted.
It sounds like with a lot of the lives that we lead, so much depends on the relationships that we're able to build and maintain, doesn't it? Yeah. Thank you. I'm trying to look at all of the questions. I know I could keep you here for hours and hours and hours. I'm trying to kind of not go too bonkers. You were talking about the importance of getting a good health report, an annual review for an EHCP, and particularly towards transition time. I wondered, is it the parent's responsibility to get that report, or should the school be, or the caseworker be ensuring? I'm mum to a medical kid, and it suddenly occurs to me, including the annual review we had a couple of weeks ago, that there wasn't a health report. There was a couple of therapy reports, but there was nothing from any of his consultants. And I suddenly thought, oh, maybe I should have gone asking for them. Is that mum and dad's, or is that the caseworker? How does that normally work?
What age is this your child in
17.
transition at the moment? Okay, so you just had your final annual review then before adulthood, I'm guessing.
Sort of, yeah.
Yes, yeah. So in my response, again, I would insist that you have a health report. I don't think you can insist that there's a paediatric consultant, for example, at that meeting, but a report would obviously, yeah, absolutely. And again, it's one of those things, isn't it? You want any of the professionals to be practicing. You don't particularly want them to sit in meetings for hour upon hour, because it means they're not actually doing their OT or their physio, but a report sometimes is as good.
Yeah.
And I personally, I would chase that up myself, and I would say, look, we haven't had a report from the consultant. Can we do that? But it's actually not our job to do that. It should be the school's job to do that. Am I right, Grainne? Or the SEN?
Again, it's all about relationships. As
It
benefit.
is.
You mentioned this. I mean, for example, my daughter has some private health input. She has private speech and language therapy. I have a good relationship with her. I just say, we've got an annual review coming up. Can you write something? So the point about the report is about, is it relevant? Is it relevant to the process that you're going through? If this is about a consultant, about something that going to have no impact on the people around, and actually probably quite a private matter that your young person does not want to be disclosed to all the other adults in the room, don't make sure that it's there, because it's not important to them. In fact, it will probably be detrimental. The young person won't trust you because you've made
Really
some
interesting.
disclosed information that they feel, that's quite difficult information. I mean, you talked about young people being non-verbal and not being able to talk, but I think, goodness, most of our young people don't want to tell people what's wrong with them or to talk to any consultant at all. But it's how you help them do that, prepare for the consultation, and find the words or the way in which you need to tell me what you're worried about, or what you think the doctor can do to help you. Yeah, so think about, what's the point of the report? How is it going to help you? And if it's somebody that you have a great relationship with, include it. For example, there's some things which are so off the wall. I got involved in a study to do with the genetics of my daughter. Nobody within the local NHS system knew anything about this. It was actually quite an interesting study. It's really relevant to help me understand my daughter. Actually, it helps her understand herself more. I brought it to the annual review. That was my responsibility, and it was a health contribution to the annual review. And I was pleased to inform the people around the table, around my child, supporting them, and they were grateful to know this information. So maybe, don't think about what the reports are. Think to do a 360 about your child. What would be helpful? Yeah. And make sure it's there.
It's really interesting to have that subtlety, because I think particularly when our kids are younger, we get so focused on gathering evidence and almost making the biggest file we possibly can. And I love the way that you're talking about saying, well, actually, hang on a minute, what's this meeting about? What's the relevance? And not everything needs to come to every table. That feels really...
Yeah. But also think about the outcomes you want for your child or your young person in adulthood compared to in childhood. And there are different ways to think about your young person. They might not need the same sort of outcomes as they reach 18, 19. They might not be in education anymore, and therefore your outcomes will be different. So it is just thinking about the individual all the time.
Yeah. Can I ask you, health seems to be a little bit of a strange place. In what age does the NHS tend to think of our children as adults and having moved into those services?
Again, from my perspective, it's down to the individual again, really, because there are some services still that I'm with, children's services, very much so. I still go to the children's unit at the Royal Surrey, for example. I've just been speaking to one of his orthopaedic consultants who will take him off from childhood into adult services, because he's the only person that will do that. So it's down to building those relationships, and when that cut off, not every relationship will stop at 18 on that 18th birthday, but you need to find that out beforehand. So again, you might find that the epilepsy nurse, for example, in children's services changes over to somebody completely different at the age of 18, but you need to start that relationship beforehand. So start thinking about who you need at that next stage, and whether they will be cut off at 18, and if they're not, great, and if they are, who's next? So start thinking ahead.
It's really helpful. We had my son we're due to have a cardiology appointment in adult services, and last year, 2 years ago, we had our annual checkup and said, we're moving you to the teenage service. It's great, lovely. We went to the teenage service, and that was his transition to adult appointment, and that came as an enormous shock. Luckily, we were then, I managed to find out, I actually found the cardiac nurse. And I said, look, can I have a chat? I don't understand what on earth is going on. I think what you say is really interesting. It does seem to be very individual. And I wonder whether it's individual to the services as well as to the child. Does that make sense?
Yeah, absolutely. Yeah, because as we know, and those who do a lot of health appointments, nobody talks to each other. So it also means that actually nobody discusses heart to epilepsy to something else. So you bring all those joined up services together, and therefore again it's down to the individual service to how far they go into your child's life and what age.
Absolutely. Can I just make a point? The paperwork around education, health and care plans says that transitions to start from year 9, 14. You know, when you tell anybody in health that this is what's happening, they get alarmed, going, no, that's too early. We don't want lots of 15-year-olds turning up in our services. But it takes that length of time for us, I think, us as parents, and for young people to start thinking of their own ownership of their own health. That's why it starts so early. But don't panic if you haven't started doing this when they're 17 or 18. There's plenty of time. The adults service will welcome you. And in actual fact, children's service will still probably look after you, maybe unfortunately in that weird experience that you had. And then there will be some teen services out there, but it's very local to how your local health structure or the particular clinical need of your child presents. So find them out.
Thank you. I'm making my way through my various list of questions. I hope that's okay. You mentioned, I really loved you were talking about the relationship with the GP and making sure your GP gets to know your young person, and you talked about annual health checks. And I had 2 questions for you. I'm always really aware that my GP's time is very valuable and there's not an awful lot of time. But I suppose I wanted to ask you, do you think it's reasonable for me to make an appointment with my young person, just a touching base, not because there's something wrong with them, but just actually that they're quite well now? Can you meet them as they are and get to know them? Is that something that would be reasonably well received by the GPs, do you think?
Yes, I would say yes, but I also say start that with a phone conversation with them and explain why you're doing it. Explain that you need to break down some barriers. They need to understand why they're coming, where they're going, but they have a right to an annual health check, so you can use that time no matter what.
That was part B actually, is if my child doesn't have autism or a learning disability, can they still get an annual health check?
Gail, can I answer this? So Benedict, that's a very important question, and one that I really hope will begin to change the culture of the world. The annual health checks are only with people with the learning disability. So, but we know that it's a process. This is not about height and weight. This is a really lovely round process that can start when children are 14, but they don't have to. They didn't exist before 3 years ago, potentially. So, and they will go up to when people are 99 years old. And I think it will change the behaviour and culture in primary care, GP surgeries, where people will notice that young people who may have autism or ADHD or any other neurological condition might not be very good at communicating their health need. And I think I'm really hopeful that a GP would use the format of this process to change its best practice. Because if you look at, a really good suggestion might be, a conversation with your GP, I need to practice, my young person needs to practice being a better advocate for their own health conditions. I know there's this thing called the annual health check. They do not have a learning disability, but this whole section on mental health, go and read the paperwork, it's all online, is really relevant. And the whole section on mental health is, there are lots of questions: mood, how you're feeling, your worries, your anxiety. The annual health check is just that. It's an MOT. If your GP notices that we don't need to focus on mental health for this young person, I'm going to focus on a certain aspect of their physical health, they will do that in the time period of the appointment, of the yearly checkup. So use that process to your advantage and just suggest your GP surgery or with your young person, gosh, how do you think about this on a scale of 1 to 10? Would you like to practice? What would you do if you were worried about this? How would you talk to an adult about your sexual health or your feelings and emotions? It's really important that we help our young people practice this, because they're not suddenly going to volunteer this information and be wonderful self-advocates for their own health and well-being. So,
absolutely. I have to say, I was on a personal note, we moved recently, and so we have a new GP who doesn't know my family, and I was really pleased because I was able to have a phone conversation with the GP to say, look, my older child has said that he might want to go and talk to the GP on his own, and it was about mental health, and I said, I just need to give you the context. And the GP was lovely, very, very professional, and actually thanked me for giving him that context, and that gives me a level of trust that I can absolutely encourage this young man to go to the doctor on his own, while still knowing that he's going to get as the best care that he can with that knowledge. It's difficult, isn't it? That trust, kind of fostering the trust between everybody.
Yeah, and it is that whole relationship building is so important. And that's also with the practice manager, with everybody within the surgery, is them knowing who you are. And knowing that you're a carer, knowing that your other children are also young carers, that's also really key, and something we talked about earlier in our talk. But do make sure that the GP is aware that you are a carer.
And professionals are really aware of these things, and they do so much training, and they want to be better at supporting individual patients, because that's what we are, on their system. So, maybe the annual review for people with learning disabilities is the wrong framework for conversations. There's fantastic tools. We Talk, Young Minds, Anna Freud. There's so many good tools to help young people talk about their mental health worries and anxieties in a very mature and professional way that they're taken seriously by their GP. So find the thing that works for your young person and support them to use it.
Thank you. Where am I going? I'm going down my list. It's fantastic. You talked about the the summary care record, which sounded really interesting, and particularly at A&E. I was wondering, do A&E staff always access that summary care record when somebody comes in? Does it come up automatically, or do they need to be poked?
They absolutely do that automatically.
Wow.
I have heard that digital systems within the NHS have joined up so much in the last 6 months. It's taken them 10 years to try and do what they've done in 6 months. And it's a really phenomenally good thing that we must keep going. It won't go back. It will never go back. I think this blended ability to have consultations online or on your phone, as well as face-to-face with your GP when COVID is over, and eventually when we have a vaccine, might be this time next year, we will always have this blended offer. But we all have a summary care card, us as individual patients, so make sure that's up to date, and on it is, I'm a carer of this young person, for example.
Yeah.
So absolutely, the A&E can access that, but they can't if there's no enhanced data on your summary care card. They don't know any more information than just what they have in front of them.
Yeah.
But other people in primary care can access summary care cards as well, and a very important person is your community pharmacist. We didn't talk about that in our seminar. So, for example, hopefully everyone's ordering their repeat prescriptions online now. They're accessing patient access. It's all happening automatically, and they're receiving it through the post, or they're getting it online. And if your community pharmacist is worried about a prescription that they don't understand or that contraindicates another medication that you're having, they can access your summary care record.
Wow.
And whilst people have been shielding because of medical reasons, that's something that's put on your summary care record, and your pharmacist will know about that, and they'll know that they need to make sure that you have this medication. So that's, for example, the knowledge that you're shielding because of medical reasons is important for everybody to realise.
Of course.
And all that information can be accessed by people.
Great, thank you. You talked a lot about these various processes and plans and things, and I was really interested in what you were talking about, advanced care plans and parallel care plans. How do where is that first port of call to learn about that, and who can help us, parents?
Okay, so this is my world, because some of our more complex children weren't expected to live until into their teens. We were told that certainly Fergus wouldn't live until his teen years, and he is, and he's extremely healthy and hopefully go well into adulthood. But we have to be prepared for the worst. And so the idea is that you look at a parallel planning, you look at a care plan, so that when things are bad, you know what the instructions will be for the medical people involved with his care. But you need to think about that and do it when they are well. Don't wait until they're really ill. Do these care plans up front and early. And then you've got organisations like Together for Short Lives. They are really key. They will help. They will have examples of care plans. CDC, again, Council for Disabled Children, again, there'll be examples of care plans on those websites, but they are there to help you. And but what the most important thing is that you do it early. Yeah. Don't wait until they're not in a great place. And it's not a nice thing to talk about the health of your child and possibly going downhill and really not being in a good place. But some of us parents have to think about the reality of where our children might be in X number of years' time. And if we're prepared for it, I mean, we'll never be prepared for it, obviously, but if you're prepared for it on paper, then that will help the decision time.
I suppose that what follows on, in my mind, is actually maybe we should be looking at things like that for ourselves in case something happens to us.
Absolutely,
which is
absolutely.
Possibly even a harder conversation for some people, isn't it?
But it's interesting because you say that, but we've been advised, we've been doing our wills and things recently, and been going through a solicitor, and the first thing they say to us is make sure you have power of attorney with each other, my husband and myself, because actually if anything happened to either of us, God forbid, then actually we have power of attorney for each other. So it should be done for all of us, and we should be thinking about it now, not when we're beginning of dementia or whatever else it might be, that these things are in place. Well, you didn't have anything else to add to that as well?
What I wanted to add, Gail, is that you wouldn't just pick this off your shelf and do it on your own.
Oh, no, absolutely.
Not everybody will need an advanced care plan, for example, or this parallel planning in this way. And that's absolutely to be done with a community nurse, or a special school nurse, or somebody that you know really, really well. You might fill in some bits of the form and then you'd come back and you'd talk about it. But absolutely, all of us should think about that future planning in some way.
And there's some big decisions in that. You're looking at things like do not resuscitate, DNRs they're called. You're looking at some major, huge decisions here which should not be made on your own. And there are professionals out there to help you do that. So yeah, and they're not. These plans are not for everybody, but they need to be thought about for those parents who have children like mine, for example.
So the organisations that you mentioned, and as you said, community nurses, school nurses, those would be the first port of call.
Yeah,
is Is it something that potentially your GP might be able to give you some guidance on, or less so?
Possibly, but it depends how well up they are on it, because again, our children are quite complex.
Yeah.
They might signpost you somewhere, but and again, you know what? I don't know what, I'm not very good on Surrey's local offer, but then maybe there's information on the local offer too, and maybe that's something that possibly should be on that. If not, then make sure it's raised and perhaps should be put on it.
Yeah, thank you. I've got a couple more questions, and then I'm coming to the end, but of the ones that have come up and on off the top of my head as well. I was really, you spoke a little bit about personal health budgets, and it's this kind of strange little world, and I wondered if you knew, or if you could signpost us to where we could find out more about them and how they might be used, if they are relevant to the parents that we've got listening at the moment.
Yeah, and that's quite important, is whether they're relevant or not, because getting a personal health budget is, again, probably more for the complex children than the children that have less health needs. But certainly in my world, the personal health budget is combined with the social care budget, and because he has continuing health care. So it's a framework that your child has to be fairly high needs of health to have a continuing care package, but that is the joint health and social care package, which we can then use to pay for various items for medical needs.
It would be, it's one of the things I find in this whole world is the more you learn, the more you find yourself in little niche things and thinking, oh, should I know about this? Should I? But it sounds as though the personal health budget is going to be for a really tiny minority of
absolutely
children.
Yeah,
but I think that's really helpful to know.
Yeah.
I suppose the last thing that I wanted to ask you is, you spoke with such warmth and positivity about the learning disability nurses in hospitals, and it's something I've heard a lot of parents say over the years. I know a lot of the parents that we talk to have children with quite complex additional needs and complex behaviours, but whose IQ is above 70. And I wondered, particularly in a hospital setting, if you end up in A&E for whatever reason, is there a flexibility with that service that they might be able to come and help because actually they have the expertise that's needed? Or are they very, very much tied to that IQ learning disability label?
Can I answer this?
Yeah, go for it.
I think absolutely you need to get in touch with them, and it will be based on their personal capacity of how much they can do at the time. They are really, like all the people that work in the NHS, passionate about the thing that they do.
Yeah.
We need more learning disability nurses. We need more people to understand how to support people with autism. Oh, sorry, can you see me? Can you hear me?
Yes, got you again.
Just.
Sorry about that. I would absolutely make a note of it. I think this whole way of talking about children or young adults can only be in here if you've got an IQ of 70. Basically, they don't have enough capacity, but they need to have more capacity, and that's why we need more of them. So if we keep asking for them, absolutely get in touch with them. I think they're a phenomenal team.
Yeah, and certainly,
Brilliant.
So we're at the Royal Surrey, and we have Vicky, who's an amazing LD nurse for children's services, and I think it's Claire, her name, who's in adult services. They have a great link up. So start talking to Vicky if you haven't already. You know, when I go into hospital, she will organise a mobile hoist for me. When we go to X-ray, she'll knows when I'm coming in. She'll try and join up services for me. But she would now introduce me to Claire. I think it's Claire. Sorry if it's not. But certainly there is an adult LD nurse at the Royal Surrey, and we have already made inroads and met her and beginning to, to link in with her. So do that, whichever hospital you're in Surrey, because I think pretty much most of them in Surrey have an LD nurse, I'm hoping, but certainly where we are, they do.
Brilliant.
A really, really top tip is get onto Twitter and follow lots of health people on Twitter, because that's where they all are.
Yeah.
And the learning disability nurses have a fantastic Twitter site, and they do loads of workshops to help family carers, because they realise that these often adults are presenting with conditions that could be sorted out before they happen. So I can tell you what that is, so you can tell everybody, and we have a resource list as well, which will go out if people give feedback and they join Family Voice Surrey. But get on Twitter, and those in particular, those LD liaison nurses, doing loads of workshops and getting people together and talking about stuff all the time. There's a really strong network of family support network out there. So find out what's happening, even if it doesn't completely apply to you, they'll be very useful.
Thank you so much. I don't have any other questions. I wanted to, if you have the time, just to share something that we experienced. So I realize I'm getting all spooky. I haven't got the light switch easily to hand. My youngest, who's 17, who is on the learning disability register, he kind of is very borderline. But what I found really amazing this year is that he received a letter from the NHS about the flu jab. And rather than one letter with, a paragraph, it was 9 pages in easy read format, including at the end a social story. And I kind of thought, actually, he's 17, I'm just going to give it to him without any explanation at all. And he read it, he sat there and he read the whole way through it, came back and said, "Oh, have you booked my flu jab, Mummy?" I said, "Actually, yes, I have. We're going this week." "Mummy, am I on the learning disability register?" I said, "Yes, you are." And it prompted a whole conversation, which actually demonstrated that if you can present the information in a way that's accessible, he has the capacity to make some quite complicated decisions about his healthcare. And it's the first time that we've experienced something like that. And I thought, actually, what a lovely example of the work that people like you have been doing in advocating for our young people. And it works. The impact on my son has been absolutely phenomenal. So thank you for all the work that you and others like you do.
It's a pleasure.
Wow.
Such a great to hear such great news stories like that, because it does make a huge difference to us. It really does.
That's why I wanted to share it, because I thought
thanks,
it might.
Benedict.
Wow, that's phenomenal. And that's what they talk about in health. Part of the problem is that they use a completely different language. So we've got to learn some new language, and they talk about shared decision making being at the very, very heart of person-centered working with people. And when you're a child, you just get things done to you. You don't, and you get dragged along to appointments. But when you get to be old enough or mature enough, or information is presented in a way you feel that you can engage with it because it's about you and you can understand it, it's meaningful, then you enter into that world of shared decision making. This is a good thing. I need the flu jab. I think I should have it. Mummy, have you helped me have it?
Yeah, exactly.
That's a phenomenal thing and that's what they talk about as young people become adults. It's that whole process around shared decision making sure that they have the right information presented in the right way to make the decisions which are right for them. And a shared decision can be, I don't want to have it, thanks very much.
Exactly, yeah.
You have to respect that, even though you think that's the wrong decision.
That's right. Thank you so much. Thank you for all of your time. I know I've learned loads, and I'm sure that our members will have as well. And I'm really grateful to have had this chance to have this kind of back and forth conversation as well. So thank you.
Thank you for inviting us. We've really enjoyed it.
Absolutely.
So yes, lovely to meet everybody.
Absolutely. We've put together, so if you sign up, if you give your feedback to Family Voice Surrey, we've put together a really, really good resource list of all those local contacts in Surrey, and lots of things that we talked about in the presentation. And we started off actually with the questions that you're going to get with your last ever annual review. And it's all the things like, does your young person understand about good health and how to maintain this? Because many of those are not answered by doctors and nurses. They are answered by people in the social care world. That's what we think of, do they know about eating well and having enough exercise? But it's a good place to start to think about transition, because not everybody will need, as much complex support and planning. It's about finding the right level for your young person, isn't it?
Absolutely. Thank you very much.
Thank you.
Thank you for inviting us, and get in touch if we can help.
Lovely.